hang on, right. We're about to do a live presentation on the benefits of acupuncture and how it works, live from Weyhill Pop-Up Shop. This is my good friend Emma, who's also treated me with acupuncture and got straight to the point, right, Em?
Absolutely.
So we're going to do a demo in a minute.
Okay, I'm live.
Oh, we've got an echo here.
I'm live, right.
Can you turn your sound down? Right.
Hang on there,
Turn it right down so we can just stream from mine, because that's going to stream straight on yours now. Right, so...
As you can tell, we're amateurs at this.
Yes, we're learning along the way. But what we want is to show you an aspect of traditional Chinese medicine that you may not have ever seen, or you don't know much about it. So Emma's going to prick me, and I'll let you know how it feels. And in the meantime, you can come into Weyhill Pop-Up Shop and see the live demonstration for yourselves, or come along and take a look at the products that we've got in store. Anyway, back to the presentation. So I'm going to come over here, and Emma's going to do it. It's going to be a relatively long and very formal presentation.
Hopefully fun as well.
And fun.
Yeah.
What's this? Hold on. Would you like to be in... Yes. Would you like to be in Becky's video? Yeah. So now I think this is connecting with you. Sorry, folks, for the headshot. Right, I can't tell him if you're live or not. Give us a moment, folks, and we'll be with you.
They're probably watching the comedy aspect as well.
I don't know if you're... Right, I was trying to get my friend Emma's to do a shared broadcast with me, but I don't know if that's working. So, I'm just going to get on and do the presentation, or rather Emma is. Right, folks, so...
Oh, which camera am I looking at? This one, yeah?
This one, yeah, don't worry about that one, because I don't know if it's working. We can just share it later. Right, so over to you, Em.
Thank you, Becky, and thank you everyone for tuning in today for this live acupuncture talk and demonstration. So let me just start by telling you what I'm going to be sharing with you today. So today is all about letting you know about what acupuncture is, how it works, and how it may benefit you. So before we get into the finer details, I'm just going to explain a little bit about how I got into acupuncture, because it's a question I'm often asked. So I'm going to give you a little bit of information about my training and my background.
Yeah, and just to say, while Emma's chatting, oh, Derek says hi. This is going to be very interactive because,
Hi, Derek.
And if there's questions along the way, if anybody's got questions, right, just feel free to ask them as we're chatting, and I will relay them to Em. All right.
Okay. So I'm just going to start by just explaining a little bit about my background and training. So I have a degree in traditional Chinese medicine. I trained at the University in Westminster. And after I qualified, I then went out to China and spent 3 months in China doing postgraduate clinical training at the Chengdu University of Traditional Chinese Medicine. And that insight gave me, that experience gave me a massive insight into how Chinese medicine and acupuncture in particular is used in a hospital setting to great effect. So yeah, I mean, as you know, that acupuncture is used in China, and some people might not know, but it is actually used alongside Western medicine in the hospitals in China.
That's interesting.
So I have over 17 years experience as an acupuncturist, and been practicing since 2002.
Yeah.
But before that, my background was in health and wellness. I trained as an aromatherapist, reflexologist. I did nutrition. So altogether, my clinical experience spans over 25 years. So that's just a little bit about my training and background. Let me just tell you my story about why I became an acupuncturist and how I got into it.
And the reason, sorry, she's sharing this is because actually you might connect with the reasons why she did this, and this might help you understand a little bit more about how acupuncture might help you Yeah, and welcome. We're going to keep saying welcome because people keep joining the conversation.
Okay.
So in case you missed the beginning, we're out live in Weyhill pop-up shop, and there might be guests coming in whilst this
I think we've got
happens.
some visitors
So we got some
arriving.
visitors, so this might well be very interactive.
Welcome.
Welcome. We're streaming on Facebook. Have you come to have a browse or to have a listen to the chat?
Have a browse.
Browse.
Sorry.
No, feel free to.
that
We're just
all
going to carry on. Please do. Yeah, this is all very interactive. So-
Can I just ask you,
Yeah.
whose idea was the carrot on that bar?
My friend had a funny idea. So look, those watching, my friend had a funny idea for a carrot in the window last night. I don't know what she was thinking. We're just going to carry on chatting. Is that right with you girls? Feel free to shop. Don't tiptoe. It's fine.
At least we know it's really live.
Yeah. So
So
Emma's talking about acupuncture, ladies. So feel free to listen and join in if you want to, and shop at the same time. Okay.
So just a little bit about why I chose acupuncture, or actually I would say acupuncture chose me. I actually always wanted to be a nurse from a very early young age, and then I got to a certain point when I realised that I couldn't stand the sight of blood, so I decided, I won't do nursing. And then when I got a little bit older, I thought, maybe I'll train to be a midwife, not realising there was even more blood involved in midwifery. So I decided not to do that either. And as I say, acupuncture chose me really because throughout my teenage years and into my early 20s, I actually suffered really badly with acne. And I've actually got a photograph of me here in my early 20s, just so you can see.
Check this
what
out.
my
I'm going to zoom in.
skin-
All right.
Okay, so I mean, this was my
Ooh.
skin in my early 20s.
What a difference. Yeah.
I actually used to work for an airline and an international airline, and I was based in the Middle East. And one day I went to go to work to go on a flight, and I was actually grounded before I could even go on the flight by the supervisor, who basically told me, you're not going anywhere with a face like that.
Really?
Yeah, and I was grounded for 3 months. Because my skin was so bad at the time.
And this is an airline, not your parents grounding
No.
you.
This was the airline I was working for.
Wow, that must have had a really
Oh,
devastating effect on
I mean,
you.
imagine being told
Yeah.
that you can't do your job because your face is off-putting to the passengers.
Yeah.
So yeah, my confidence was really not.
Yeah.
So I had to find other ways to kind of like solve my skin problems. Long story short, I gave up my job actually, and decided to train as a therapist. And along the way, I found acupuncture, and I was actually treated by an acupuncturist who was actually a GP as well, but he no longer practiced Western medicine. He just practiced acupuncture and herbs exclusively, and within 3 months of starting my acupuncture treatment, my skin was clear, and people were actually saying to me, my God,
Wow.
what are you doing? Because there was such a visible difference. So acupuncture and Chinese medicine literally gave me my face back, but not only that, they opened the door to something much bigger for me, because it can literally just change my career. I decided to go down the Chinese medicine and acupuncture route. Hence why I'm so passionate about sharing it with you, and why I'm still practicing it, 17 years later. So that's just a little bit about my training and background.
So just anybody that's recently joined, I don't think I put a title on this live feed. This is a talk on acupuncture and the benefits and how it can work for you. So with Emma Gordon-Stables. Back
Welcome
to
if
you.
you've just joined us. So why are so many people embracing Chinese medicine today? Because it's one of the fastest growing medicines in healthcare today. So why do you think that is? Does anybody have any ideas about why they think it is?
Yeah, feel free to message, and Emma will just carry
Yeah.
on chatting, and
Yeah.
I'll pick up your messages
Yeah.
as we go.
So, Becky, you might have your own thoughts, but I mean, a lot of people are actually sick and tired of feeling sick and tired, and also because people, it's word of mouth recommendation. Often people come to acupuncture because they've tried everything else, and I was a case in point, because I had done all sorts of things to help my skin. You know, all the conventional stuff. I'd been on antibiotics. I'd done sunbeds, which was recommended by a GP. I'd done so many different things, and I was at my wit's end. And so most people come to acupuncture as a last resort rather than a first resort. And had I known what I know now, then I would have turned to Chinese medicine and acupuncture a lot sooner. But as I say, you know, until you're exposed to it and you're at your wit's end and you don't know what else to try.
Yeah. And what would you say the reasons are that it helps in a much? Why would you have gone to it first before regular Western medicine? What do you think are why is it a better or more rounded treatment? What's the difference? Why would you?
So I think the difference, one of the main differences between Western medicine and Chinese medicine is that Western medicine just tends to focus a lot. Western medicine is great; it's got its place, but it's great for emergency type treatments. So you know, surgery and drugs for kind of like, you know, acute type situations. Whereas with chronic long-term conditions, and I mean, my skin was a case in point. I mean, I'd had my skin problem since my early teens, and it was chronic, and it wasn't improving. You know, with anything I tried, you know, antibiotics, etc. So I think because Chinese medicine looks at the whole person, it embraces the whole person. It looks at your, you know, your body, your mind, your spirit, your emotions, and I think that was the missing piece of the jigsaw for me.
So it's a whole person treatment.
Yeah, exactly.
And actually, quick question that sprung to mind: if you know, you mentioned about using traditional Chinese, acupuncture as a preventative medicine. You know, like you say, Western medicine is wonderful, but it can often treat the symptoms after they've manifested as a disease or an illness.
Absolutely.
Do you think, as well, with Chinese acupuncture, you can use it to enable well-being as a
absolutely so
ongoing thing?
There's a saying in China, treating a person when they're sick is like starting to dig a well when you're thirsty.
Yeah.
So, you know, because by the time you've actually got thirsty, it's actually too late. You need to actually start drinking and digging that well before you get thirsty. And in fact, in China, the acupuncturists were paid to keep the patients well. If the patient became sick, then the acupuncturist wasn't paid.
That's amazing.
Because they hadn't done their job properly. Now, can you imagine if you know, that's how, you know, doctors operated in this country?
I couldn't imagine. Yeah. Could you imagine the difference the NHS would face?
Absolutely. Yeah. Imagine you know, your doctors paid you, or you were paid because actually you weren't sick.
Yes.
Yeah?
That's a completely different mindset.
Yeah, totally.
Yeah.
Yeah.
So, that's great. So
moving
tell us some more. Yeah.
Yeah. So moving on. So that's a little bit about why. The other reason why people are embracing
Your
Chinese
little man.
medicine. Let's just adjust the model here. Is because people also, you know, it's a way of avoiding surgery. You know, I always say needles before knives.
Yeah.
So you know, if you can avoid going under the surgeon's knife, I mean, sometimes you have to, but you know, if it's something that you can do.
What kind of things? Yeah. What kind of things do you think that would avoid? What kind of illnesses?
Well, I mean, I'm thinking like, you know, sometimes like something like sciatica can be caused by kind of like a trapped disc, and sometimes that does need, you know, surgery, but other times it can you know, other interventions like acupuncture or chiropractic can be equally effective. So yeah, it's just you know, you don't always have to turn to kind of like, you know, surgery. I think surgery should be a last resort rather than the first resort. Yeah. So, as I said, Chinese medicine is fast becoming the #1 treatment of choice, and it's proven to be effective, and it's very safe. It's cost effective, and it's becoming increasingly popular. So
Llewellyn says hi.
Hi, Llewellyn. Long time no dance. So I'm just going to clarify some of the main objectives of acupuncture treatment. So the main objectives really are to relieve pain.
Oh, see, Corrie says you really help with my plantar fasciitis.
Oh, yes, I remember
Yeah.
treating you for that, Corrie. Yeah, I'm glad it helped you. Yeah, plantar fasciitis is something that you see a lot of, actually.
Was it?
Yeah, so it's quite a common thing that people can suffer with, but a lot of people don't realise that acupuncture can help, you know, that condition. So yeah, if you've got plantar fasciitis and you haven't thought about acupuncture and Chinese medicine, then it's worth bearing in mind.
Great.
So yeah, it's great for relieving pain and other symptoms. It's also great for strengthening the immune system and helping keep you well. So, you know, from the preventative aspect. And it also helps to balance the body internally. So it helps to balance the internal organs so that everything is homeostatically balanced. So those are some of the main objectives of acupuncture treatment.
Okay, and the overall arching thing is for overall well-being is to focus on your own well-being, right?
Yeah, absolutely.
And to maximise that, which
Yeah.
I think, personally, I don't know, we get so used to a certain level of pain and forget what it's like to be in true full health.
Absolutely. I mean,
with
health
all the
is
stresses
really
of life.
Really, you know, health is energy. So, you know, when you start to lose your health, you start to lose your energy. You know, you lose your zip, you use your get up and go. You know, you just feel tired and lethargic all the time. So all of this, you know, is really what underpins Chinese medicine, because basically good health is all about having good energy. And we're going to talk a little bit more about energy and qi, which is what really underpins traditional Chinese medicine.
And that's in, I just got goosebumps. That's what's exciting. Right, so how does acupuncture work? Is that what we're...
Well, I mean, acupuncturists have been treating billions, literally billions of people, including mighty Chinese emperors, for thousands of years.
Yeah.
For one simple reason.
Hi Sam, sorry Sam's just joined from the station. This is my friend and Emma Gordon-Stables. Let me know, would you yeah? Do you want to try them on, or would you like to stop? Yeah, of course. I'm going to put this here. If you don't mind us streaming, you can carry on chatting, Em.
Okay.
My friend Emma is a traditional Chinese acupuncturist, Sam, and I'm just going to leave her to carry on chatting about how acupuncture works. You just carry on your presentation, Emma, is that right?
So, as I was saying, acupuncturists have been successfully treating billions of people, including mighty Chinese emperors, for thousands of years, for one simple reason: because acupuncture works. And chronic pain, more than any other condition, is what brings most people into the acupuncture.
I realise I need my phone to take.
But there are lots of conditions that acupuncture can be used for. So, as I say, pain is the number one condition that is what most people know acupuncture to be effective for. So this can be things like neck pain, back pain, knee pain, sciatica, you know, physical types of pain. So how many of you listening today would like to be free of your pain? Because maybe acupuncture is something that you might like to consider.
Right, give me 2 seconds. I'm sorry, I'm going to have to take a payment, right? So I'm just going to go off. Hopefully this will stay.
Okay, you did it.
It's still live. Connection available. We love it. Thanks for the patience, guys.
I think we're back.
Let me get your bag. Would you like to leave your email address?
I haven't got one.
Other reasons why people might
Let me get you a lovely bag.
have acupuncture. It can help with things like improving your digestion and things like sugar cravings. So it can help to balance the digestive system and help you metabolize,
Thank you. We're going away
so it can help with
Monday,
things like
and I
weight
need a
loss
wind
as well. And it can also help with your energy levels. So how many of you here, or how many of you listening, actually wake up tired in the morning, or you feel tired during the day, or you just, you know, you just don't have the same vitality that you you're used to, you know, perhaps when you were younger, and you'd like more energy and you'd like more get up and go. So acupuncture can work really well for raising your energy levels. It can also help with things like stress and anxiety. I get a lot of people suffering with those conditions. And of course, stress and anxiety, it manifests in different ways in different people. So as an acupuncturist, you know, it's not one size fits all. There's a whole person, and we treat according to the individual constitution of the person. So it's a very individual, very tailor-made treatment. So no two people are ever going to be getting the same treatment, even if they're suffering with the same ailment. And what about, yeah, I said poor sleep. You know, lots of people have problems sleeping, can't get to sleep, or they wake up and they can't get back to sleep, they're restless. So there's a paradox going on here, isn't there? Because, you know, on the one hand, you've got people who, you know, are tired and lethargic and fatigued. And on the other hand, you know, you can't sleep at night. So you're having to take sleeping pills to help you get to sleep. So there's a paradox going on, and you know, often when our energy is out of balance, we have these, you know, conflicting symptoms, and then we need, you know, 10 cups of coffee in the morning to help us wake up and get going.
I know that feeling, Em.
Yeah.
Yeah. Oh, hi, Pat. Hi, thanks for joining. And hi, John. John Booth's just joined, Em.
Oh, hi, John.
So Emma, just to recap, obviously, John, you know Em because she works from Base Point with you up the road here. Pat, Emma's a good friend of mine, and acupuncturist and aromatherapist as well.
Let me just give Your Mind, Your Body a plug, because I work at a Your Mind, Your Body Health and Wellness Clinic, which is up, well, for those of you who don't know where it is, it's up at Base Point Business Park. So I work alongside chiropractor John Booth and Siobhan Booth, who's a hypnotherapist and also specialises in anxiety and helping people with confidence. So she's a confidence coach.
Brilliant.
And there's various other therapists up there as well. We have an aromatherapist, Debbie, and Mel. So back to acupuncture.
Brilliant.
So some of the conditions that acupuncture can help. So the World Health Organization has identified a list of conditions that acupuncture can benefit, and some of them are listed here, but this is by no means all. So things like allergies, asthma, carpal tunnel syndrome, colds and flu, constipation, although being British, none of us like to talk about our bowels, do we? Gynecological disorders, so, you know, things like premenstrual tension, endometriosis, even fertility problems we know that fertility, there's a lot of women having problems conceiving, and that's an area that Chinese medicine is very, very positive in.
Okay, and do you get many men coming to you as well as women?
Not for fertility problems. But having said that, men can obviously benefit from you know, having acupuncture for things like erectile dysfunction, and you know, in, you know, kind of like, yeah, you know, low sperm counts. You know, men obviously aren't quite so. I think they're a little bit worried about where you're going to stick the needles.
Understandably, right?
Yeah. But the needles we usually place the needles usually below the elbows and below the knees. We do use needles in the back and occasionally in the torso as well. Yeah.
And if anybody's watching, Emma's going to stick some needles in me in a short while, so you can see
we're gonna
see what it's like.
We're going to move on in a minute to the demo. But I just wanted to highlight some of the you know, conditions that acupuncture can help. So as I say, this is just a short list, but there are many, many more conditions that acupuncture can help. And I'd just like to share this quote with you as well. This is one of my favourite quotes, and it says, "The body is quite literally our vehicle for being, for giving, for loving, for moving, for feeling. And if it doesn't work, it's fairly certain that nothing else in our lives will work either." And it's a bit like, I think about, use the analogy of a car, because, your body is a bit like a car. If you're driving along in your car and all of a sudden the red warning light comes up on your dashboard, you've got two choices, haven't you? You can either carry on driving and completely ignore that red warning light, and then, sooner or later something is going to go catastrophically wrong.
And I think what kind of warning lights are we talking about? Because I think people get used to the way they feel, so they actually don't know what full health or full vitality or full energy feels like, because you'll get used to a certain level of that.
Well, a warning light could be something like a headache. It could be something like pins and needles or tingling in a arm or a leg. It could be all sorts of things. Pain obviously is a major warning light. But whenever we get those, those signs and symptoms, we need to take heed, and we need to, stop. So, in the analogy with the car, you're going to stop your car, ideally, and, then take your car into the garage and get it checked over. Because if you carry on pushing, through it, then, the chances are more damage is going to be done. You're going to have a massive bill. You might even have to buy a new car. Now, obviously, we can't buy a new body, which is all the more reason to look after the body that we've got, and to preserve it as best we can, and to listen to it when things go wrong.
Yeah, and actually, that's the whole point in this. But welcome to anybody that's joined. We're streaming live from the Feel-Good Weyhill pop-up shop, and actually, the idea behind this shop was to focus on well-being and feel-good factor, because actually, I think we don't always take the time to nurture ourselves and focus on what feels really good and positive to our bodies, minds and spirits, because we get so busy and stressed with life that we don't take the time to focus on things that will actually make us feel better. We only deal with them when they become an issue, which is exactly what Emma's just saying. So actually, this is a really... Oh, hi Claire. Claire Foss, nutritionist, has just joined.
Hello, Claire.
So we're just talking about the benefits of acupuncture, and how in China they used to get paid if people became unwell because the acupuncturists weren't doing their job then. So it's a completely different philosophy than here. So we're just talking about how it can help you.
And now we're going to move on to who has acupuncture. Despite acupuncture's reputation and its popularity, a lot of people are actually put off having acupuncture. Why do you think that is?
The pricks, the needles. Perhaps people have a fear of.
So most people have, including myself, actually. You won't believe this, but I'm terrible with injections. I actually have been known to pass out having injections and having blood taken. I have a real phobia about injections. However, I'm absolutely fine with acupuncture needles, which sounds well. Why would you be okay with acupuncture needles and not an injection? And I'm going to explain why about the differences between a hypodermic needle and an acupuncture needle. But I just want to reassure people out there in Facebook land that actually the Chinese also fear the needles as well. So it's natural to be afraid of something like a needle. However, the Chinese fear the diseases more than the needles. So they would rather go and see an acupuncturist to have the needles put in them to keep them well, rather than having a disease like, Parkinson's, or having a stroke, or having some chronic, degenerative disease, that they perhaps could have prevented, you know, in the first place by having regular treatments. So it's, you know, it's a perfectly normal fear for most people to have, a fear of needles.
Hi, just like to say hi to Joe, my neighbour's watching, and Jay, if Jay's still online, you know.
Okay.
Jay. Hi.
So I'm going to just show you a little bit about acupuncture needles, okay, and actually explain to you the difference between a hypodermic needle and an acupuncture needle.
Can I just zoom in and show people the needles in a moment?
Of course, yeah. So, unlike hypodermic needles, acupuncture needles are hollow.
Hi, Chris. Hi, Chris
not
Gardner.
hollow, but solid. So, so this is an acupuncture needle. Now, in a hypodermic needle,
Just zoom in.
a hypodermic needle is hollow. It's usually used to put something in you or to take something out of you, like blood, which is usually an uncomfortable procedure. Anybody who's had blood taken or had an injection knows that it's not the nicest of experiences. But I say, by contrast, an acupuncture needle is incredibly fine. It's almost hair-like. It's you know, it's so thin and it's very slender and slim. So, Becky, do you want to just come over here? You probably can't even see this needle, but
Actually, come closer. See,
yeah,
let
shall
me
I
see.
come here?
If you
I'm
stand
just
about
gonna-
there, right?
So
what are you going to do?
So I'm going to just demonstrate, and if you just want to
here, yeah.
put your finger on the needle, if you press
I just
maybe
see.
down like that,
What, like that?
yeah, and you can see
yeah.
how
It's almost like a guitar string.
yeah, so it's very flexible and it's incredibly thin. Okay, so and obviously it's the main tool we use in a treatment. Now the needles also come in different sizes because obviously we use different size needles for different parts of the body. So this one would be used somewhere like the wrist, for example, where there isn't much flesh. And also the other thing I want to reassure people is that all the needles are sterile and they are only used once, so they're single use, and then they get disposed of in the sharps container, so they're never used again on anybody else.
That's good to know.
So they all come, as I say, in their separate containers. And then, you know, each one is used individually.
So can I just ask a question at this point? And I might be skipping forward in your presentation. So when you use the needles,
yes,
how do the needles? What do they do?
What do they do? Okay, so
and is this part of your presentation in a minute?
Yeah, I mean, but since you asked, basically, what happens is when you put the needle in,
and this is for acupuncture. If anyone's just joined and they haven't quite got that, but I'm sure you can. You can see.
So we have energy circuits in our body, which just like you have arteries and veins, which carry blood around the body. We have energy circuits which aren't visible to the naked eye, but just because they aren't visible doesn't mean to say they don't exist. And what happens is we're tapping into these invisible channels of energy, which basically are called meridians, which is where the chi, the electrical energy of the body, flows along the circuits. So when we put a needle in, what we're doing is we're actually tapping into a person's electrical energy. And so it's a bit like, the way I liken it is when I put a needle in, what I'm doing is I'm plugging you into the mains, and then I'm switching on the lights. So it's almost like it's lighting up your whole energy circuit. So I kind of liken myself to a body electrician. What I'm doing is rewiring the electrical circuits in the body. So if there's like an excess of energy in the body, and that can perhaps manifest, for example, if there's an excess of energy and maybe there's a short circuit, it might manifest as somebody who's got very high blood pressure, who's very stressed, who's got a very, red face, they feel angry all the time. And so when we put the needles in, what we're trying to do is to kind of like disperse the excess energy,
Okay.
redistribute it. Whereas if somebody's got a deficiency of energy, perhaps they're very tired, they're depressed, they're sad, then we might want to bring more energy to their body. So depends what needs to be done. But the needles will either redistribute the energy to where it's needed, or they'll bring energy to where it's needed.
Okay.
That's oversimplification. Shall we get on and do the demo? And,
Yeah, let's do it.
and then I'll actually,
Yeah.
demonstrate putting a needle in Becky, and then so come and sit down, Becky.
I don't know, we've got one viewer at the moment. Where do you want me?
That's fine. Okay, I'm going to do a needle I'm going to do a point on your hand. This point I'm going to do on the hand here, okay? It's called large intestine 4 in acupuncture speak, and it's actually a very powerful point. It's a command point for the whole head and face. And so if you've got any pain, like toothache or headache,
Tension in my head.
yeah, it's a very good point for the head and face. But it's also a great point for the nose. It helps to, in combination with another point that we might needle here, helps to open the nose, which can be really good for people with things like hay fever. We're coming into the hay fever season now. But colds and flu. It can also be used in conjunction with other points for energy, for calming. But for the purposes of today, I'm just going to demonstrate.
I feel nervous.
Okay, so there's nothing to be nervous about, and I'll just explain.
Despite the fact I've had this done many times.
Yeah. So what's going to happen is I'm going to put the needle in fairly quickly. All right. You might feel some sensation. So it's true to say that acupuncture isn't painless, but neither should it be painful either. Okay, it's just an unusual sensation, because when we tap into the electrical energy system, particularly what we call the chi, often I can feel the sensation of chi on the needle when it arrives at the same time as the person experiences the sensation. So it's almost simultaneously. And what can happen, which is really amazing, is often people will describe the circuit where the energy goes. So I could put a needle in up here, and somebody will say, "Oh, I felt that in my second toe." Well, they don't know that the channel actually goes to the second toe. But so that's what I find incredible, when people have no knowledge about acupuncture or chi, and they start telling me where the circuits are. Yeah. So, okay. So if I can just get to your hand, Becky. I'm just going to feel for the point. I like to massage it beforehand. Okay. It probably feels a bit tender there.
Not too bad.
Okay. You ready?
Yep.
Ooh, there it goes. Okay. So she might have felt a slight tingling,
It's
or
like
a kind
pulse.
of
And I can feel that.
Yeah.
That's amazing. I can feel. I've got this a sensation that ran all the way down my arm to my elbow.
Okay.
Almost like, you know, when you get a dead leg.
Yeah. So it can feel. It can, when you get connection with the chi, it can feel heavy.
Yeah.
It can make the area that you've put the needle in feel very heavy. It can feel tingly. It can feel like a dull ache. So that is what acupuncture it tends to feel like. It shouldn't be like a sharp shooting kind of like, stabbing pain.
I feel that's really strong.
And
Down here. Why is that?
It's probably connecting, because the channel doesn't actually run down there, but there is another channel that runs along here. So it might be, connecting to that channel.
It's almost
underneath.
like I've got a pulse in the underside of my hand.
We might need to do that one then as well. So just in case you're wondering how long these needles would stay in for, normally leave the needles in for 20 minutes, which would be a kind of typical treatment. time. Obviously, I'm not going to leave the needle in Becky for 20 minutes today, but that's just so that you know that they're normally left in for about 20 minutes. And acupuncture can be surprisingly relaxing. A lot of people actually fall asleep on the table and are surprised how relaxed they feel afterwards. So yeah, it's surprisingly relaxing once all the needles go in. And typically during a treatment, the number of needles can vary. It depends on what you're treating, and also depends on things like the age of the person that you're treating. If you're treating somebody who's elderly, maybe you use less needles. If it's a chronic condition, you might use less needles if the patient is very weak and tired, as opposed to somebody who maybe is, you know, younger and more robust and stronger, where you might use more needles. Because their energy is stronger, they can take it, whereas somebody who's, you know, tireder and weaker, you know...
I thought that would be the opposite way round, actually. You might need more needles to have more...
No, definitely not.
And tell me, if you're just doing this for health and well-being, and you're trying to prioritise that as a preventative thing to maintain well-being, how often would you recommend treatment?
It's a really, really good question, Becky. And it's a bit like saying how long's a piece of string, because everybody's different. It really depends on why the person is coming in the first place. So what the condition is that you're treating. If somebody's maybe got something very acute that they've only had for 2 or 3 days, then maybe, you know, they only might need, you know, 2 or 3 treatments over, you know, a very, you know, concentrated period of time. Whereas somebody who's perhaps got a condition that they've had for 10 years would require more, you know, longer term treatment. And because acupuncture works cumulatively as well, that's the other thing I want to mention. It's a bit like if you have acupuncture once a week, you know, you will get results from it, and you will feel benefits, but it usually takes around 4 to 6 treatments for people to start feeling the benefits of the acupuncture, because it works cumulatively. So it's not a quick fix. If somebody's had a condition for a long time, obviously a 1-hour session of acupuncture is not going to, you know, change their lives overnight. It takes time, because it's taken time for the body to get sick in the first place, and it takes equally time for it to heal and repair itself.
So if I just wanted to do this for well-being, how often would I come to you?
Initially, I'd do an assessment, and I'd find out what was going on with you, and, you know, and then I would give you a kind of like a treatment plan. So I might suggest that you perhaps come once a week. If you're, you know, not in acute pain. If you're in acute pain, then I might want to see you more frequently initially. But the idea is that you to have treatment anymore.
So quick question then. If in China, Emma was saying earlier that the Chinese pay the acupuncturists to keep people well, and they're not done their job properly if they get unwell or disease, right? Yeah. So at what point would they treat those people if they never get ill?
Well, what would happen is that they would just be having treatment on a regular basis, maybe seasonally.
So quarterly?
Yeah, seasonally, just to keep them sort of like in good, you know, health. It's a bit like taking your car in for an MOT, isn't it? And having, you know, an MOT once a year, just to make sure that everything is working, you know, you've got the right oil levels and you know, the water's topped up. So it's a bit like that. You can have acupuncture, you know, you don't have, that's the other important point to make, is that you don't have to be sick or unwell to have acupuncture, but most people only come when they're not well, which, you know, and as I said, it's usually as a last resort, which is always a lot harder to deal with. Bless you, Becky. Bless you. It's clearing your nose. Yeah. So just trying to think if there's anything else need to tell you about the actual treatment itself. So normally when somebody comes for an acupuncture treatment, I do a proper consultation, which involves obviously talking to you and also looking at your tongue and taking your pulses, and then from the information that we gather, I can then make a diagnosis according to traditional Chinese medicine.
Which would give you a direction of where.
Which would then inform me, you know, of my treatment plan, and you know, how many treatments I'm going to recommend and what sort of frequency to see you.
Yeah, and just to clarify, so I understand, or everyone else does if they're watching, when you put the needles in and you diagnose them and you've got an idea of how to treat them, how would you know? What does that actually mean to you? So how would you know where to stick the needles, and what does that represent? Are you working with the meridians that you were talking about?
Yeah.
To rebalance the energy? Is that the idea?
So
can you just talk a little bit about...
so these are the meridian circuits. You've got 12 main energy lines throughout the body. And as I say, these are a bit like electrical channels that run throughout the whole of the body. And how we choose the points is going to be very much dependent on our diagnosis of your condition, taking into account the tongue and pulse, and whether we think you're somebody who's got what we call an excess problem or a deficient problem. Okay.
Energy.
Deficiency of qi or an excess of qi. When we're talking about qi, we're talking about energy.
And would that be those things? Is that like a predisposed excess that you're naturally have a propensity to? Are you born that way?
Okay,
is it lifestyle and stuff that makes that happen?
Really good question, Becky.
And we'll come back to the acupuncture.
We are born with a certain amount of inherent qi in our body, which we inherit from our parents, and in China or in Chinese medicine we call this jing, which is basically essence. Okay, so depending on your parents' health and also where you are in the family, whether you're the eldest child or the youngest child, will determine how much qi and energy and vitality you're born with. As the other way that you can supplement your qi is through your diet and your lifestyle. So eating a good diet, and also doing things like meditation and breathing exercises, because is going to really supplement your qi. But you're born with a finite amount of energy, and once you've used it all up, basically you die. I mean, the main difference between somebody who's alive and somebody who is dead is basically the energy, because if you look at a dead body and a person who's alive, they've both got legs, they've both got arms, both got eyes, but the dead body can't see with their eyes, they can't move their limbs, they can't think, and the main difference is because the energy is being switched off.
So
in
all
the
the
body.
organs, essentially, in the body are run by the energy that's created.
Yeah.
So what starts the energy? Where does it come from?
Good question. Yeah, good. Well, that's the $1 million question, isn't it? I mean, qi basically is the animating force that runs through not just living things, but non-living things as well. It's it's what generates your computers at home. You can't actually see qi, and but just because you can't see it doesn't mean to say it doesn't exist. It's a bit like the internet. I mean, I haven't got a clue how the internet works. I don't know if anybody else has either, but we still use it and we still get benefit from it. You don't have to understand it in order to be able to get the benefit from it. And it's the same a little bit with Chinese medicine. You don't have to understand, the nuances of qi and all the circuits obviously I do because I'm practicing it, but you know, as a you know, lay person, you don't have to understand all the subtleties of it in order to be able to benefit from using it. So
You just soon know when you don't have enough of it.
yes, yeah. If you run out of chi, yeah, you'll know all about it.
That's great. So the meridians, yeah, we were talking about those just to finish on.
Yeah,
your treat basically.
So basically, yeah, I mean, as I said, there's 12 main energy circuits in the body, and what can happen is sometimes the energy circuits can become overloaded, and you know, like, and then you can blow a fuse effectively,
which would be the equivalent of
kind of, well, it'd be equivalent of like, you know,
pressure.
yeah. I mean, I'm just using kind of analogies, but you know, a typical businessman, you know, very stressed, busy, you know, eating on the run, you know, got no time to relax, drinking a lot of alcohol, you know, rich, you know, dinners, and I'm just giving like a kind of like an analogy of what that might be, you know, how it might present somebody with an excess of energy, somebody who really you know, also loses their cool very quickly, you know, somebody who's quick to anger, who fires up easily.
I can think of a few people like that.
I think we all can, can't we? Compared to somebody who
Obviously,
is
I'm
very
perfect.
compared to somebody who is, you know, who's very depressed, who's very anxious, who's, you know, I'm kind of, you know, again, I'm you know, just using kind of very simple analogy here, but somebody who has a deficiency of energy and is constantly tired, you know, and doesn't have the energy to do anything. So, and they might have been to their doctors and they've had all the tests done and there's nothing physically wrong with them. The doctors can't find anything wrong with them because actually the problem is in their electrical circuits and the wiring of the body, the chi. Yeah.
And can you just talk a little bit about the impact of stress on our energy for anybody watching, like modern life?
Yeah, I mean, that's another key thing is that, you know, we are affected by, you know, our environment. So, you know, things like, you know, the weather, yeah, can affect our chi if it's too cold, if it's too hot. Our diet.
So this is all about energy. If you just tuned in, Chi as an energy, and Emma is an acupuncturist. In case any of you have just started watching, so we're talking about energy and how stress and lifestyle affect.
Yeah, our Chi. So things like you know, what we ingest. So certain foods can affect our Chi because food has an energetic quality. So some foods are cooling, some foods are heating. So things like alcohol and coffee, for example, are generally considered more heating. So if you're a fairly cold, you know, chilly person, then, you know, you might be okay with those things. But if you're a very hot person, then having too much, you know, spicy food or too much alcohol or too much coffee is going to stimulate you even more and make you even hotter. And that can affect the energetics of the body. Emotions are a massive cause of you know, stress and can negatively impact on the energy system.
So if they're unexpressed emotions, if they're repressed, or
well, both really, but particularly if they're repressed. So repressed anger, for example, can go inward. And it can be, you know, it can come out as depression, for example, because the energy isn't being expressed. So
can I ask you another question? Because I know, you know, depression is a lot of people suffer from depression.
Yeah, it's very common.
From a an Eastern philosophy, you know, Chinese point of view, how would you help? What would be the main cause of that in your mind, from an energetic point of view?
So often something like depression can be seen as either a stagnation of chi, where the chi is not moving in the body, it's got stuck, or it can be seen as a deficiency of energy, a deficiency of chi and a deficiency of blood, where there isn't enough energy to fire up the body. So it depends really, again, these are subtle nuances that an acupuncturist would be able to detect. Okay,
So stuck chi or not enough
stuck chi or deficient
energy.
chi.
And could you help that with?
Oh, definitely,
acupuncture?
yeah. Because as I say, the needles can disperse stuck chi, or they can bring energy to an area. So yeah. So
Great. Anyway,
let's take that needle out. I'm sure you've.
What
Okay.
would this have done anything for the short time it's been in here at this point?
I mean, it's not, obviously I'm not doing a proper full treatment, so it's not going to adversely, have any, negative effects. But, you might find that, you might feel more relaxed. You might find that can breathe a little bit clearer. But no, it's not going to have, because I haven't really used it as a treatment.
Can it cause bruising? Acupuncture needles?
It depends. Sometimes it can. If I mean, as you can see, you can't even see where the needle's been, but occasionally you can get a little bit of blood, and sometimes you can get a small bruise, but it's the exception rather than the norm. It's usually about 3% of people. Yeah.
Right, brilliant. Thanks, Em.
Okay.
Right, should we wrap up?
Yes, I think
You've been watching for a while if anybody's still. Oh, hi, there's been quite a few people joined. Right, so that was Emma Gordon-Stables doing an acupuncture demo on me, and if you want to listen back, I'll be posting this this video on my Facebook page, and it had loads of fascinating tips on how acupuncture works, the kind of things that it can treat, and the reasons, you might consider having acupuncture as an alternative treatment. So Emma, perhaps you'd like to tell us a little bit about where you work and how you can get in touch. And actually, is there an opportunity to have a conversation with anybody that might want to just know if it can help them? How can they get in touch with you?
So if anybody's listening and they want to know more about acupuncture, then you can contact me through my website. So it's www.acupunctureassociates.co.uk. The email is info@acupunctureassociates.co.uk. My phone number is on the website as well. I do offer complimentary consultations, which are about sort of 10-15 minutes. If anybody wants to come and have a chat to me about how acupuncture might benefit their particular condition. And I work from the Your Mind, Your Body Health and Wellness Clinic, which is up at Portway Business Park, Unit 39. And feel free to get in touch if you want any more information, and I'll be happy to talk to you more about acupuncture. And if you've got any further questions, you know where to find me.
Brilliant. Right, and that's fine. And for everybody else that's still watching, I'm going to jump in front of the camera. There'll be a series of other wellbeing holistic therapists talking next Saturday here at Weyhill Pop-Up Shop. We're open until the 18th of April, and the theme is all about feel-good factor. So we've got a series of artisan products here, a selection of artisan products, all from local people, although we've got a lady that's also sourced Solo Mia from some clothes from Italy. We've got some burlesque clothes and some little naughty things, feel-good factor. Some handmade lingerie from Lizzie Kessel. Jewellery and handbags from Vicky Rules, and some beautiful chocolate for vegan. All the vegans watching us. Graham, I don't know if you're still live.
It tastes amazing as well.
Yeah, it does, and it's made from coconut sugar and butter, so it's better for you, and it's not cooked to such a high temperature, so it's got some good properties still in it. And yes, we've got Claire Foss, a nutritionist, joining us next Saturday for a hormonal balancing workshop. You can book online. And then we've also got a bra fitting service for all you ladies watching. The benefits of wearing a good sized bra, the best sized bra for you, and having a proper measure up.
From one extreme to another.
And also we'll be having a lady from IC Kinesiology, Iveta. She'll be talking about the benefits of kinesiology, and she'll be doing a little demonstration and talk here as well. So stay tuned on Weyhill Pop-Up Shop on Facebook, for more information, and pop down and see us until the 18th of April.
And just like to say, may the chi be with you all. Thanks for listening and thanks for watching.
Bye. Oh, I'm just going to post Emma's email address in the comments before we go. So it's info@acupuncture.
That's acupuncture with one C, not two C's. Most people spell it with two C's. But it's actually one C.
Acupuncture Associates. And actually, you'll also find Emma's on Facebook. So tune in. Oh, earlier, in case you missed it, I've also got a live stream of Claire Henderson giving an amazing Indian head massage. So she talks about the benefits of that. So have a look on my Facebook page. Right, cheerio, folks. Bye.